please visit Tripoli. It's this fantastic Mediterranean heart-healthy, brain-healthy food, which was donated by Birch and Bowes Elder Law, UT Health School of Nursing, the Caring for the Caregiver program, and Home to Home for seniors. So, yay, yes, thank you. Round of applause for those guys. They bought you lunch, so say thank you to them. Okay, with that, I'm going to hand it off to Daryl Greer, who is the master of all things. We sit on like 400 committees together, I don't know. And I'm still stumped here. Wait, how do I introduce Daryl? I'm going to let Daryl introduce himself with Senior Plan at the Oaks program through AARP, also another great program. All right, there you go.
Thank you. Hi, how are y'all doing? My name is Daryl Greer, and I work for a nonprofit called OATS, Older Adult Technology Services from AARP. I love my job. Basically, what I do is I help older adults and caregivers connect to everyday technology. Nothing new, nothing fancy, just the type of technology that's in our pocket that we kind of know how to use, but we're constantly trying to figure out how to better use it in our lives. So then with OATS, our tagline is aging with attitude. There are two things. We are age reframers. We believe that aging is a good thing, right? There's nothing we can do about it. However, as we age, what we learn and what we want to do is spend time closer with the ones that we love. We're also technology enthusiasts. We believe that technology is positive, even though at times we may be too inundated, in which we're overflooded with technology. We feel when it's used and trained to individuals in a responsible way, it will allow us to live fuller and more independent lives. OATS, like I said, is Older Adults Technology Services, and what we want to do is harness this tech, these devices that are already in our vehicles, that are being implanted inside of us, and that are strewn throughout our houses and communities, so then that we can better connect with one another. Our training programs is through our Senior Planet branded programs. Basically, people in San Antonio, our programs are no-cost lectures, workshop, and multi-week classes that our trainers deliver in person at the centers. In other areas outside of San Antonio, we have a licensing program that allows us, in which we train other organizations to gain access to our materials, and we train them on our methodology. What's great here is that I'd like to have a few thank yous. First up is our training team right here. We have Ramona and, how you doing, Elizabeth? They're the ones who are helping coordinate the technical portion of this event. We have like around a solid 75 individuals that have been on since we started, and I wouldn't be surprised if it's more that folks have dropped off. In addition, we have a person in the exhibitor hall, Frankie, who has all of the information and resources in which we can give you, especially on our next classes. And then for the first time this year, we are experimenting with a remote site, which is Last Chance Ministries. Once again, all of this is possible in connecting communities together, but through the use of Zoom and tech, right? So then it's really, I'm happy for that. So then our founder, who was Dr. Thomas Camber, he was a housing advocate in New York City, and he worked very closely with policy. He realized in the 90s, that's when basically internet started to get connected to our homes, that no matter how much money was thrown with devices in these communities, or how strong the internet signal was, there was a segment of the population that was not connected. Does anybody can guess who that would be? Older adults, right? Why? And what it was interesting is that Tom, what he did is that he realized it was a revolution in education. Basically, the systems of how individuals learn back when older adults were in the classroom from the 40s and 50s are completely different to how classrooms are today. When you buy a car, it's full of technology. How do they train you to use that tech? When you get a new phone, what do they give you? What type of understanding do you have to use the full aspects of these $1,000 phones? What Tom was able to do was to see the need, and he didn't invent anything. There's no gadgets, there's no subscriptions or anything else. he basically rearranged the information that was free and available and put it in an order that older adults can better understand. And then, of course, when we think about this, was occurring in the 90s, so it's like, when we think about the 90s tech to now, much has changed. In 2000, where did we go to watch a movie? Theater or Blockbuster. If I wanted to listen to music in my car, what was I using? Cassette. I heard DVD, right? If I wanted, it's amazing to see how technology in that short amount of time has changed everything. Now we stream movies to our home that are basically brand new in the movie theaters. We're able to get an archive of music, you know, spans hundreds of years, but it's all at our fingertips. Now we have home assistants to where we ask it particular questions about anything, and it gives us a response. And today, AI is implemented in the background of many things that we do. So later on in today's conversation, I'm going to talk a little bit about AI, but then also just talk about tech trends. So Tom, he saw the need, and he was able to create this curriculum and this methodology to help older adults understand the ever-evolving role of technology. That was in 2014, and in 2013, what he did was he created the first ever technology exploration center. Basically, it felt, and the look is that of like an Apple store. It's very sleek, very cool, but everything that was there and the technology that older adults could get their hands on were free and available. That was very popular because if you can think about the way aging looks like here in San Antonio, but then also consider what aging looks like in New York. It's like, how do people age like that? High, densely populated community, sky-rise buildings, cold, people have pets. There's so much stuff to where, you know, when I visit our home office, I'm like, I am happy and glad to know that I live in a city to where it's just friendlier for an aging community. I don't know if folks know, but our DHS Comprehensive Senior Center, they're NACOA certified. That means that they're world-class in the services that they render, not to mention that there's so many other services that are built in the background of the centers to help look after our older population. In other cities and in other states in the United States, it's not that. Maybe you have to pay a monthly service, and it's nowhere near the same quality. And that's something where I've observed in New York City, to where I'm like, no, San Antonio, we're doing it right. All right. What is that? But then, what is that? The classes grew throughout New York City, and then, grew throughout New York City. OATS spanned nationally to different states. We also had in-person teams in Maryland, DC, Florida, Colorado, and California. In San Antonio, Texas in 2018, there was an investment through the Humana Foundation, which was basically a research project. And the whole goal of this project was to use technology as an intervention to social isolation. Basically, what we were doing was training older adults who are at risk of isolation and showing them how to use a laptop, a Chromebook. And through this 3-year study, we were able to demonstrate that first, older adults can learn technology. Second thing, that older adults want to learn technology. And then lastly, when individuals learn technology, they're able to apply it into different aspects of their lives. So you teach somebody how to protect their information and do an internet search. Next thing we were able to see is that those individuals were applying for jobs. They were connecting with family members or music or anything else, which was great. From that point, that kind of changed OATS's focus on just community and teaching programs or technology, but now honing into social isolation. In 2020, we all know what came down the pipe, COVID-19. That was a horrible disease that killed so many older adults. It was really a disease that killed 80% of older, or those individuals who passed were basically older adults. And when we think about how, even then in 2020, there are a lot of individuals that did not have home internet. To get the vaccine, what did you need to do first in order to do it? You had to register online. You had to have internet to your home. You had to have been able to navigate these long government forms in order to do that. So then with our programs, what we wanted to do, at least we pivoted into training and embracing technology as a need to change individuals' lives and health. In 2021, Oates became a charitable affiliate of AARP. Basically, this has been an awesome venture in which we're able to use the strategy and network of AARP to help rural communities and also urban communities of older adults to use technology. And in 2024, we've connected with OpenAI as a societal resilience fund, basically to help share the benefits and also the risk at time at AI. All of it to make sure that people are aware that these tools are available. All right. So then what is AI, right? AI, we've all heard it in the news, right? And it's like a computer. It's a computer that thinks. Kind of looks like, or kind of seems like it's lifelike. It's alive or not. Up there on the slide it says, a field of computer science where systems uses machine learning to recognize patterns, make connections, and perform tasks. What is that? I don't know. I read the words, right? But I don't really quite understand what it is. So then through our classes, what we've been able to see is that if we think about computers from, like, let's say 10, 15 years ago, right? They're different. How computer programs were written is very different. If we think about a calculator, right? There's a program, right, for it to do addition. The input is going to be numbers. 2 plus 2, and then there's an equal that sums up everything to 4. Very simple, right? But then now with AI, the way that the computer programs are being designed and run is that we're training computers how to learn. And it's through algorithms. Instead of writing very defined codes of computers to do addition, now the codes that are being written is how the computer or the device can source the answer through a new set of input. That data and input is basically the internet. And if we can think about how deep and rich the internet is with information, it's amazing. The speeds of microchips and everything else are getting faster. So then it's when I think about, like, your Google, your Alexa, all these devices, do those have AI?
Yes.
No, they don't. What's interesting is that those are very complicated computer programs where you ask it a question and it gives you a voice response. However, the information that it's being sourced is very particular. Google, what time is it? Google, is it going to rain? Those are very different. What's different with AI is that it's a fluid conversation. You could ask, is it going to rain? And then with AI, I use Google Gemini, you can ask why. And that why, it'll give me a conversational response about climate, weather patterns, and everything else. Then I can follow up with even more information or more questions to learn about why it's going to rain. It's very amazing. And it's in some ways, I see it as a disruptor in the aging community, especially within caregiving, but also there's some risks there. There's a lot of nefarious individuals and a very powerful tool that could be used against us. So then AI, this was a study that was taken through our classes in New York and nationally, both in person and virtually, and it shows that AI is gaining interest amongst older adults. When we did a study in 2013 or 23, 9% of older adults were interested, and now that's grown to 18% in 2024. So then let's see, another 30% are excited about it. This next slide right here basically kind of gives a demographic of it. So when you look at the 38% and 31% of those individuals are interested, that means that's over 60% of the older adults that are interested in using the tech. When we look at people that are not interested at all, or that's what, 11%. And some of the reason why the interest is there is that it's already coming up in our news media. It's already being implemented behind the scenes at our banking, in which technology, with AI, it's great. So then within our surveys, we were asking about what is it that older adults want to learn regarding AI? How is it going to impact their lives? And basically, it's everyday uses. That means it's asking questions. Maybe it's to socialize. Maybe it's to learn a little bit more about an app or your phone or how to figure out a feature on your car. Other areas is healthcare. I mean, and some of the presentations that we saw today had a lot of in-depth information, a lot of items that I wasn't too sure about, beta amyloids, protein clusters, and everything else. Who do you go to when you have those questions? And what I see that AI is able to do is to be that little pocket professor or person to help you understand, to be that tool to help you wrap your head around a complicated issue. So then when I think about AI and its uses of every day, it's like a peripheral device. For example, if you have poor eyesight, what do you use? If you have poor hearing, what do you wear? So then if you're approached with a new concept that you just don't know, maybe legal affairs, maybe it's a medical condition or new medication, AI could be that tool that you can ask a question to become better informed. So then AI has a lot of opportunities, and it's already changing the different types of industries, like in health. There's a type of AI which is called predictive AI, which is used to measure and identify patterns. That particular AI is also used in the financial services as banking. Whenever that's able to prevent fraud, in which they see certain types of usage or questions that are occurring at a particular bank. At any one time, maybe you have like 100,000 hits regarding a particular website or password. That's signaling that there's some type of fraud that could be there. Supporting individuals in their quality of life. So then I've seen a lot of folks here with like wearables. And those are great devices in which it's showing you your biometrics, your heart rate, maybe your blood pressure and other things like that. In the coming future, those devices maybe are going to become more AI equipped to where they're going to be more interacting with many other smart devices that we have to help monitor or trigger different types of alarms to let us know when we are not, our body is not acting well, not being as healthy. It can predict health, such as falls. So then right now, in this emerging area of AI, we also have robotics. And the robotics and AI thing, that's a very real future in which, I know Elon Musk in Austin, Texas, they do have robotics that are already out, set to market for, what is that? I want to say like around $30,000. Whether or not you agree with it or not, it's already here. And when I think about the home health type of field, on having a robot that's AI equipped that can monitor a loved one 24/7, a day, I think that's kind of an amazing type of product. And it's real. These are things that will be coming down. Yes. So that goes into what is it that older adults want to learn regarding AI? Did I just do that? Everyday usage. Yeah, healthcare, being able to monitor an individual's health, and then also just overall education. I use AI a lot. I use it to help scan or proofread some of the items, or just to learn about a particular portion of my job. In my job, sometimes I have to learn about Mississippi. I don't know much about Mississippi. I've never been there, but through a conversation with AI, I'm able to learn about many types of stuff: the population, the industries. The services, the DHS services at a particular location. It's amazing, and what's beautiful is that it's not me typing a prompt into a computer that has 10,000 different results. It is a fluid conversation from A to B about a particular topic that's ongoing. Opportunities, as I mentioned, within public health, let's see, it can produce risks, false. Okay, here we go. Mental health. Older adults have specific needs. A lot of older adults, what they're looking for to use AI even more is their health and wellness. When you look at socialization and then you're having a robot or artificial intelligence interact with, it does make you feel a little more connected, right? Less isolated, I should say, especially when you're trying to figure out a complicated issue. Wealth, personal finances. For those that are creative, for those that are entrepreneurs and looking for ways to innovate, to market, to understand a new way to market an idea that you're currently doing, AI can help be that thought partner to help you kind of refine your business. And then, of course, just being a self, learning and then self-development and creativity. All right. Now, when it comes to AI, helps the home safer, more convenient, and make it a safer place. Today, right now, we have a lot of voice-powered assistants like the Alexas. Those are not enabled, AI enabled. But in the coming near future, a lot of the wearables that we have are going to be AI enabled. That means they're going to work more coordinated within our homes, also within the device, between the devices. And then, of course, on the horizon, that's where we're going to have more devices with robotics to basically automate a lot of the things that we currently do around the house. In a recent study, University of Oxford, artificial intelligence predicts up to 40% of the household chores are going to be automated, which is amazing. If I think about my current house or the houses of my in-laws, we already have devices that are similarly doing that. We have a Roomba, right? We have thermostats that are able to adjust, their cameras, their security. It's just a matter now of having a smarter system that's being implemented into these devices to where now we'll have more effective cleaning and other mowing the lawns and other things as well. Not to mention too, I do feel that this paves a future of folks living more independently in their homes. Of course, the benefits of AI means that, a lot of automation, a lot of smarter technological devices, but then there's a lot of risk as well. As we can see, it's learning, right? It's creating a lot of cloning, a lot of deepfake videos and stuff. And that's something where that is very serious. There's a lot of phishing, a lot of smishing, which is basically like a text. You get a text that's like, "Hi, how are you doing?" And then you put in your information, or you're like, "Hey, who's this?" And then it's like, "Hi, I'm Carl." All of that's AI. All what it's doing is trying to fish information to map our personalities just so it learns more about us. And then when you think about like a lot of the fraud that's being committed with like really, romance type of relationship types of scams and fraud like that, if individuals are not protecting their information like in social media, or if they do not know what too much information is to share, what that's doing is creating greater chances of this fraud to occur. And what AI does with some of these bad areas is that it's trying to get more and more information about the individuals. Yes, and then also it's like with some of the AI, when you put in prompts and you ask it to there's in one of our classes we have a lecture where we do a generative prompt to be like, show a man on a bicycle, riding. And if you look at the image that the AI will produce, it's always a pristine, perfect view. It's not really a representative view of what maybe is in our mind. So AI in a visual sense can kind of manipulate or is a bit biased. To where, we always want to bring that up in our classes. However, AI is constantly evolving. It's getting better and better and better, making less errors. So then with some of the classes that we have classes that introduce the concept of AI all around, everyday uses of AI, in which it runs through different types of examples of how AI can be used. We also talk about image generators and voice generators to talk about the technology behind it, but also the risks as well, just so that people become more informed or aware of different types of scams. We believe in, of course, the adoption of these types of devices. It builds, our classes help folks become more confident and more resilient to fraud or different types of technology about AI, but also within other topics of technology. We have tons of resources on our website. If you go to seniorplanet.org, we have a variety of training channels. Here in San Antonio, we have an in-person team. We also, through our partner sites, and then we also have virtual programs as well at our seniorplanet.org. A lot of our AI curriculum is there, and it's done live on Zoom. We have a lot of resource pages specifically on AI and fraud. And then, of course, we have hotline, a multilingual hotline that have classes in English, Spanish, Vietnamese, and Mandarin Chinese. And we have a few of these guides Frankie has in the other room at our table if y'all would like to learn a little bit more about AI and some of our classes. And then, of course, for locations that are outside of San Antonio and that doesn't have a team, we have a licensing program in which we work with like governments, library systems, senior centers, or churches in which they can learn to develop a proficiency in technology so then that they too can start to educate their folks as well. There's no cost to this particular program, and we have over 500 locations. All right, thank you.
Wow, that was fast. That just scrambled my brain more than AI does just by itself. Well, good. Thank you, Daryl. And again, thank you to Oates and Senior Planet for your tech help. Folks online, you owe them your life. I don't know, you'd be staring at a blank screen. We do want to thank also to the UT Health Science Center, our tech team, the tech, like Robert, is that right? Yeah. So thank you very much, Robert. You helped us so much, so thank you guys. And so, as we say thank you to UT, we couldn't hold this without this space. This is fantastic. And so supporting that, of course, is the Biggs Institute, which spoke this morning, and Caring for the Caregivers, which also was one of our lunch sponsors. Right? Lunch? Come on, right? Everybody, so I'm going to introduce Dr. Roxana Delgado to talk to you guys about what Caring for the Caregiver does. We've saved the best for last and tell everybody else. Hang on.
You're very sweet. Thank you so much. We're very honored to be here. My name is Dr. Roxana Delgado. And it was mentioned, we supported the lunch. We know that if you have empty tummy, you're not going to be able to concentrate. So hopefully you really like the lunch as much as, we all did. So Caring for the Caregiver, we're here for the caregivers. We're here for the family members and friends and church members because we know that caregiving is not just family members. So sometimes we see a lot of church members and neighbors and people coming to us asking, how can we best support someone that has dementia or Alzheimer? So we're here, we have a program, and I don't know if you're going to see these slides that continue to come over, but we have different services for you. The caregiver, we want to make sure that you are equipped to take care of your loved one or friend. We want to make sure that you have everything that you need to improve your quality of life while you do that. Many of you here have already experienced some of our supporting services. One of them, and I need to give a shout out to Daryl and his team at Oates, because we have been able to train over 200 caregivers in digital literacy. How do you access the computer and go into telemedicine, make appointments and things like that. So we're not only about healthcare, we also help you and teach how you can best be part of the community. We collaborate with the Botanical Garden, and we have a beautiful program where you can go and do gardening or just come and say hi and be with other caregivers. So anyway, we are part of the nursing school, the School of Nursing, and we have a tremendous team that is ready to support you and ready to be there walking this journey with you. So enjoy the rest of the day, and thank you so much for this time.
Thank you, Dr. Delgado. I love how kind of modest she is. They do so much, and so does she. I know her husband, Victor, has a nonprofit as well that serves veterans.
Hi, I'm Daryl Greer, Regional Program Manager for Oates from AARP. On Saturday, August 23rd, I'm working with the Alzheimer's Association for a very special presentation on technological trends for caregivers. Caregiving for somebody with Alzheimer's is a profound responsibility. Did you know that every 65 seconds, somebody in the United States develops this disease, affecting more than 6 million Americans? In today's digital world, caregivers also face a new set of challenges. According to the FBI's 2024 Internet Crimes Report, older adults suffer the most losses to online scams. with Americans losing a record total of $16 billion. During this presentation, we'll discuss free online resources available through OATS's flagship program, Senior Planet, to help you navigate the digital world safely. Join us on Saturday, August 23rd. You can attend this event in person at the UT Health Science Center's main campus in San Antonio or join us online via Zoom. For more information, please call 1-800-272-3900. Together, we can make a difference and support caregivers in a technological world. I hope to see you there.